So I treat cases of low thyroid every day at clinic. And if you're suffering from any of these top 12 symptoms that I'm going to go through, then you could also benefit from getting your thyroid checked and treated. Okay, so you're tired, you're gaining weight, you have dry hair, dry skin, brittle nails, sensitive to cold. These are all the common thyroid symptoms that people are aware of. However, if you're suffering from any of these other symptoms we're going to go through, it also could be an indication that you need to get your thyroid checked because it is suboptimal. Weak legs or tight muscles. It's common that I have clients complain that their thighs are always tight. Often you'll see plantar fasciitis on both sides, chronic tension through the shoulders. These could also be signs and symptoms that your thyroid is not working properly. Depression, anxiety, and irritability. These could all be linked with thyroid imbalances. So if you are suffering from these, before you start any medications for anxiety, depression, check your thyroid. And I would also probably say check your hormones as well, just to make sure there's not an underlying imbalance that's causing these issues. Brain fog is another really big one. The inability to concentrate, that can be linked with low thyroid. They can also be linked for females with low estrogen levels. You will also see imbalances in the menstrual cycle. So they can be too heavy, they can be more painful, they can be infrequent, they can be too frequent. All of those can be linked with thyroid imbalance. Now in terms of the physical signs and symptoms, the puffiness under the eyes, puffiness in the throat, sometimes swelling. You see swelling in the hands, fingers, around the ankles. Those can all be linked with low thyroid function as well. Not to mention the other symptoms that we'd already been through before that is more visible, like the dry hair, thinning of your hair, thinning of the outside third of your eyebrows, and nails that split and crack easily. Now, low thyroid symptoms more commonly start in females. I think it's like 5-to-1 female to male, most commonly after the age of 40. However, you will also see it in females after giving birth, like shortly after, 3 to 6 months after, or sometimes even while you're still pregnant, you'll start to see the levels of thyroid drop. In those cases, they often correct themselves, but not always. So if you're dealing with any of these symptoms, in the next video, I'm going to show you how to properly check your thyroid, what the optimal levels are for TSH, free T3, and T4, and how that will apply to your case. Thanks for watching. And again, I'm Doc Yates, wishing you optimal health. And if you're interested in booking a phone consultation with myself, you can do so using the link below.